Welcome back. Now I have the great pleasure of introducing a very good friend of mine and a very talented and gifted physician, Dr. William Maykel. How are you?
I'm great, Christina. Thank you for having me on your show.
Now, every time I talk to you, there's something new that you've been working on or discovering, and I love when you share these things. So today, first of all, let's talk about you and how long you've been a physician and what's new in your practice.
Well, I'm a chiropractic physician. I've been in practice for 36 years. I've treated about 45,000 different people from all over the world, about 90 different countries.
Wow.
And through the process, I've actually specialized in two new evidence-based medical specialties. One is called functional medicine. And if you look at this tree of medicine right here, the doctors in the trees are the medical specialists, and they'll give you a diagnosis. And right now in our $2.8 trillion healthcare system, about 80% is for what are called the chronic complex diseases: asthma, allergies, diabetes, heart disease, autoimmune diseases, chronic regional pain syndromes, and autoimmune diseases, as well as neurodegenerative diseases.
Right.
So back in the year, and the other 20% is for trauma. So back in the June of 2000, we completed the Human Genome Project, in which they found that the chronic complex diseases take place on dozens of genes. So getting a diagnosis with one or two or more drugs aimed at helping the symptom complex go away has not been effective. Unfortunately, according to the World Health Organization, we're about in 37th place in the world, spending a lot of more money than any other country.
So the United States is in 30th place in the
37th
world. 37th
place.
place in the world.
Correct.
So generally you have an ache or a pain or a sniffle or whatever, and you go to a doctor who deals with that, an allergist or pulmonology, and they will then take care of their, their specialty and give you a medicine, right?
Correct. And so the new evidence-based approach of functional medicine actually addresses the root cause. So if you go to the trunk of the tree of medicine,
right,
there are 8 different biological systems that affect all of the organ systems. And that's blown up in this picture over here called the functional medicine web of wellness.
Okay.
And a web implies if you tweak one, it affects the others. So just to go around the clock on the web, your attitude is your body-mind balance.
Right.
And I tell people to look in the mirror, tell yourself how much you love yourself.
Yeah.
That's the easy part. The hard part is what your self-talk is, because most people's self-talk is relatively negative. So you have to turn the audio recorder internally a couple times a day.
Like, I'm horrible, I can't, I'll lose, I'm so tired.
So if you keep your self-talk above board, you have, doing that one thing alone will lower all causes of mortality by 50%.
So you're saying by just not letting that inner voice be telling you how you're tired, you're no good, I'll fail. If you stop that, you increase your mortality, your non-mortality.
Correct.
Right.
So you improve your overall health. And then
Right.
your structural alignment is one of
Right
the struts. And then the other 6 are pretty much nutrient involved. And we used to say you are what you eat, but as we've gotten smarter now, we say you are what you eat, digest, absorb, detoxify, and eliminate. And about 80% of your immune system sits right in your small intestine. They're thinking of calling that the primary brain now instead of the secondary brain, which Louis Gershon wrote a book about 10 years ago, because your small intestine that has about a tennis court worth of absorbed surface area
Wow.
is your integrator of your nervous, immune, and endocrine systems. And when you have good integrity of the lining of your small intestine, you have much better overall health and a less tendency towards neurodegenerative diseases, autoimmune diseases, and all kinds of other problems.
Right.
So then on a cellular level, how well does a cell get rid of poisons and recycle energy? And how do cells talk to each other? What do they say? And that's got a lot to do with your diet and your fatty acids. So I tell people that I browse this web of wellness using professional applied kinesiology, which is another new medical specialty that actually uses functional neurology through the manual muscle test to evaluate a person's not only structural alignment or their neuromusculoskeletal system, but also their functional gastrointestinal, immune, and endocrine systems.
So in other words, if I came to you, which I have, and now the way you would test that is you always say, okay, lift your arm, and then you go. And then if my arm goes down, that means there's something not functioning really well because in the layman's terms.
So there's a diagnostic tool named the challenge. We live in a receptor-dependent nervous system. That means that our nervous system is monitoring these pressure and position sensitive nerve endings that are not only wrapped around every muscle, organ, and tendon, but also they're spot welded onto every cell. We now know that your shape of your cells and what the signaling is at the cell membrane actually tells your DNA what to do. So
wow, that's
that medicine is
interesting.
really evolving quite a bit.
So then, are we done with this chart? Do we flip
Yes,
this over now? Okay,
yes.
and then we flip this over because now you're looking at something that's fairly new
This
that
is
you're introducing, at least to our market here.
correct.
All right, so let's talk about that.
Well, basically, let's talk about what are the major, why would I be, why as a preventive medical specialist would I be interested in something that would measure the lining of your arteries non-invasively? And it's simply because the top 4 causes of death in the U.S. are cardiovascular disease, cancer, the medical system, and prescription drugs taken as prescribed.
Wow.
So heart disease kills about 620,000 people a year.
Right.
And more women than men have died from heart disease since the mid-1980s.
Right.
As a matter of fact, a woman has about a 6 times more likely chance of dying from a heart attack than she does from breast cancer.
Wow. Yeah, I know. I've heard
So
that.
it's a really big problem. And
So this is one of your blood vessels, and you say how many blood vessels do we have if you stretched them apart?
right, so you have about 62,000 miles of blood vessels. In the one
Wow.
cell lining thick is called your endothelium. And that's about 6 tennis worths of surface area. So that represents the largest endocrine organ in our body. And
So if it's clogged
that
or-
single cell lining mitigates what's going on in the blood with what's going on in the muscle soft tissue of the artery.
Right.
So it acts like an air control center, or another doctor called it the brain.
Yeah.
And it mitigates what's going on as far as the clotting of the blood and the blood pressure. And the endothelium is responsible for producing, as an endocrine organ, a gas called nitric oxide.
Mm-hmm.
And that's what makes your cells, your arteries resilient. It reverses plaque, it lowers
Right.
blood pressure. So basically, the more nitric oxide that you produce from your endothelium, the healthier you are.
Right.
As a matter of fact, we now know that when you do hard, sustained cardiovascular exercise, it makes your body produce more endothelial nitric oxide.
Right. I know there was a recent study that came up with that. So what you do, if we come to your practice, which I did, you hook me up into, explain what we do, because I just went through this.
Well, the reason that we would want to do this, first of all, is that
Right.
the approach that's been taken is not working. So
Right.
in the last 8 years, the amount of heart disease in those 18 and older has increased by 1%, and in the 65 and older, it's increased by 3%. So clearly, the use of the cholesterol model isn't working. So cholesterol is actually essential for us to live. So
Right.
it's responsible for the formation of myelin, which is responsible to conduct electrical signals through our nervous system. It's
Right.
also responsible for the production of all of your hormones and things like vitamin D and bile salts for your acid to get rid of poisons are all derivatives of cholesterol.
Right.
So every mammalian cell membrane needs cholesterol to function normally. So I guess with the increase of heart disease gradually coming up, even though we've been using plenty of these statin drugs, they haven't been as effective as we had hoped.
Right. I know studies came out. So proactively then, so you're taking a proactive measure, you're asking your patients and the people to come see you and our audience to take proactive measures to find out, first of all, do you have your arteries are clogged? And you
Right.
can find that out through the technique that you...
Right. So there's a new technology that is has the best outcomes data associated with it, and it's a machine called the EndoPat.
Mm-hmm.
So it stands for a plethysmographic arterial tone of your endothelium. And what it is it's a quick, non-invasive test. Person lies comfortably down.
Yep.
2 calipers are put on their index fingers, and then the brachial artery is occluded for 5 minutes, and then it's opened up. And when your arteries revascularize in one arm, it compares it to the control, and then a score is given. And the more nitric oxide that is produced as the blood rushes in, the more dilation the artery gets, the better your score is. So if the cutoff is about 1.68.
Right.
So if you score of 1.68 or greater, that means you have good, healthy endothelium. And
That's
if you're
great.
lower, you don't.
So that means I was a little bit lower, so I have to really look at my minerals and my vitamins that I'm taking
Right.
to help me cleanse
So
my...
we don't know who going to have endothelial dysfunction.
Right.
Because of the fact that you could, you run and you take really good care of yourself and you had a score of 1.41.
Right.
So that means that we have some work to do. And endothelial dysfunction precedes heart disease and stroke, as well as kidney failure and congestive heart failure by decades.
Wow.
So it's called the risk factor of all risk factors by the American Heart Association.
Let's clean our vessels. Now, Dr. Bill, I have to bring you back so we can do more, but I love always having you here. It's so informative, and I did this exam. I just laid down. I took my power nap while it's being done. It's just put on your fingers and then the cuff, the high blood pressure. Thank you so much for being here. And as you're speaking, your information's coming up and where they can come and see you. And I advocate. I've had aches and pains that have gone away after you've really worked on me. Thank you so much. I'm glad you're introducing this. I haven't heard anybody in the area.
Yeah, we're one of the first clinics in New England to offer this service to people.
That's great. Well, thank you.
Thanks for having me.